Just as computers keep getting faster and smartphones keep getting smarter, radiation therapy is also advancing technologically. Today, it is therefore possible to calculate the required radiation dose very precisely and to define the radiation field even to the exact millimeter. As a result, fortunately, the acute side effects of the therapy are generally quite mild. However, how well the treatment is tolerated in each individual case depends, among other things, on the type and location of the tumor, the amount of radiation dose administered, and the radiation technique used. In addition, doctors of course need to assess the patient's overall health and whether there are any comorbidities that need to be taken into account. Because no matter how high-tech the technology is, it is never entirely possible to prevent some normal tissue from being exposed to radiation along with the tumor. This is what causes the side effects. But the good news is that healthy cells are able to recover from radiation damage much faster and better than cancer cells. But precisely because you can't know how strongly someone will react to radiation therapy, you should definitely be aware of the side effects so you can be well prepared. So let's take some time to take a closer look at this. So, what can occur immediately after radiation are nausea and headaches. This condition is also called radiation hangover. Most of the time, however, these symptoms go away after about 4 to 5 hours, and often you only experience them after the first few sessions. After that, the body more or less gets used to it. As a precaution, children or adolescents shouldn't eat right before the radiation session, but rather 3 or 4 hours beforehand. That way, you won't accidentally throw up the food. It's also a good idea for patients to just take a nap after the radiation session and basically sleep through the symptoms. One side effect almost all young patients experience is also the irritation of the skin as well as the mucous membranes due to the radiation. Meaning that the areas of skin and mucous membrane exposed to radiation become very sensitive and easily injured. Basically, it's like having a sunburn. So you should make sure to protect and care for them well. If you want to learn more about skin and oral care, just check out the video that covers what you should pay attention to during and after radiation therapy. Another common side effect of radiation can be diarrhea, because this also has to do with the mucous membranes, specifically the ones of the stomach and the ones of the intestinal lining. The mucous membranes are especially affected when the radiation is applied to the abdominal or pelvic area. However, during therapy planning, care is taken to protect the organs as much as possible. For instance, it is also best to stick to a low-fiber, easily digestible diet and make sure you drink enough fluids. Otherwise, of course, there are also medications that your doctor can prescribe for you. Just ask about it. If the head is irradiated, hair loss can also occur as a side effect. Because radiation therapy is a local treatment that only works where the beam is aimed, not all your hair will fall out as it does with chemotherapy, but only in the area that is irradiated. Usually the hair starts to grow back about 3 months after the end of treatment. They may be a bit frizzier or more unruly than your other hair. However, it can also happen that the hair falls out permanently if the radiation is applied very close to the surface. That is, if the tumor is located directly just beneath the skull bone. In that case, the hair cells above it get the full dose of radiation and unfortunately do not recover. Most of the time, though, this can be concealed quite well with a different hairstyle, for example by simply wearing your hair differently afterwards. Among the side effects that can occur with a delay are fatigue and exhaustion. Strictly speaking, these symptoms can actually appear at any time, but often they only show up to 10 weeks later. So even when the radiation treatment is long over and you no longer expect it. Why this happens is not exactly known. However, it could be related to the fact that the body is busy clearing away all the tumor debris. Yes, and that takes a lot of energy and makes you tired. What can be said about all these acute side effects is that they can generally be managed well, and as mentioned, they do go away again. However, long-term damage can also occur. This becomes apparent months or even years later, also known as long-term effects. Some children who received radiation to the head, for example, might later struggle with concentration problems and learning difficulties. In some cases, radiation has an effect on growth or metabolism. There is also the possibility that a second tumor could develop later at the irradiated site. But the doctors will discuss in detail with you the specific long-term risks that may exist in your particular case. We have also made a separate video about the late effects of cancer therapy in children and teenagers. And one more positive thing to end with. Because more and more children and adolescents can be cured of their cancer, we are also learning more and more about the long-term health effects of the therapies, that is, the treatments. And that means these problems can be identified and treated better and better. So fortunately, you can assume that in the future there will be new solutions and ways so that those who have successfully overcome cancer in childhood can lead a happy and long life.